As COVID-19 sweeps across the globe, designing healthy cities is increasingly more important. Experts say it's more than just healthcare, social and urban environments that have to be carefully considered.
So for a closer look, we're joined by Professor Lam Khee Poh from the NUS School of Design and Environment. Professor Lam, so what exactly would you consider a healthy city in this context of COVID-19 pandemic?
Well, I would start by looking at the people that inhabits the city. If the people are healthy, then the city is healthy. That's the ultimate test. You cannot theorize about it and nor fake it. And its impact is applicable to everyone, from the infant to the young to the elderly. Now, the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So the factors that contribute to the state of health would then include the natural as well as the man-made environment. It is a very, very complex ecosystem, and everything is connected in one way or another, whether we are aware of it or not.
Professor Lam, how do you measure then the quality of life in a city, for example? What are the key factors that contribute to that?
Well, again, the World Health Organization defines quality of life as an individual's perception of their position in life in the context of the culture and value systems in which they live, and in relation to their own goals, expectations, standards, and concern. So it is a very broad-ranging concept that affects, in a very complex way, a person's physical health, psychological state, personal belief, social relationships, and their relationship to salient features of the environment. So in short, it's really about the body, mind, and spirit. The measure of quality of life is primarily done through surveys. And WHO has their own survey instruments that they have developed across the world using subjects that are actually patients as well as people who are well, and the healthcare professions. And this survey sort of instruments are available in over 20 countries and languages. Then there are also other sort of news-based ranking system, like the US News Ranking, which Singapore ranks about 20 out of 73, for example, in one of their ranking system. And then there is also the Economist Intelligence Unit, where they rank an interesting term that they use, where to be born index. They converted the word quality of life into this where to be born, which is very interesting. And in that, Singapore ranked 28th in 2019. And the way they measure or survey those requirements are about opportunities for a healthy, safe, and prosperous life. It's about subjective life satisfaction and also objective determinants of the quality of life across those various countries that the survey. And last but not least, there's also the Mercer's Quality of Life Index. And Singapore was ranked 25th last year and in the world, and they were ranked top in Asia.
Okay, Professor Lam, but really quickly, taking all that into consideration, what should urban designers then keep in mind when planning a city to ensure that it promotes healthy behaviors and well-being? Really quick.
Yes. So the design of healthy cities is really about space and time. And we need to look at space not just as a two-dimensional feature in terms of square foot, but we really have to look at the volume, because we all exist in a volume. And I think the pandemic situation, again, sort of highlight to us how important it is to have sufficient sort of volumetric consideration in terms of ventilation in order to help us, be much more effective in providing this healthy environment. Now, cities traditionally are planned in a very segregated way, and we separate recreation and industry and residential for efficiency, but that's not necessarily an optimal way, right? we must create variability, connectivity in form and function. Environmentally, our cities must remain cool and must be able to breathe so that our air quality, both outdoor and indoor, can be really maintained to support the healthy living.
Okay, many thanks for your thoughts this evening and sharing them with us. Professor Lam Khee Poh from the NUS School of Design and Environment.